During the last several months, as our world strives to overcome the devastation of COVID-19, I am overwhelmed by the importance of ARCS' mission, which is solely focused on the unrestricted financial support of up-and-coming American scientists. We all have experienced some degree of COVID's negative impact in our personal lives. So what could be more important right now than building up the very individuals we are turning to navigate us out of this pandemic? Now, we are pleased to present one of Emory University's top scientists to discuss the impact of COVID-19 in children. Dr. Chahroudi focuses on viral infections in children and teaches at the Emory School of Medicine. She also directs the Center for Childhood Infections and Vaccines at Children's Healthcare of Atlanta. Dr. Chahroudi, we are delighted to hear from you today.
Thank you very much, Mariella. It is my great honor to speak to this distinguished group today. Thank you so much for the invitation. I have really enjoyed getting to know more about the ARCS Foundation since I received this invitation, and seeing the videos of the scholars earlier in this program was truly inspiring. So I was asked to share with you a little bit of the science behind what we know about COVID-19 in children. And I'd like to do that by a few slides that I have. If someone could load those up, that would be wonderful. Okay, great. So the title of this brief talk is COVID-19 in Children and the Path to Normality. And I put an asterisk after normality because over the course of the pandemic, we've heard a lot of people point out the fact that normal, or what we thought of as normal, wasn't always so wonderful for certain populations and certain people. And so I think that this pandemic, as well as a lot of other events in our country and our world, have made us think more about what is the ideal and where do we want to end up once we have defeated this virus? Next slide, please. So we've all seen these headlines. I think every day you can look at the paper and you see a headline that relates to COVID-19, and many of them relate to COVID-19 in children. And from day to day, you probably see headlines that are, one says one thing and the very next day it says the exact opposite. But I've been following very closely the discussion and the discourse related to COVID-19 in children, as well as school closures and reopenings. And so these are some of the headlines that I just wanted to share with you today. And a lot of the conversation is happening regarding the risks and benefits of virtual schooling as well as in-person schooling. So we'll talk a little bit more about that and how we may overcome some of those risks in the future. Next slide. So what are the main issues? These are the issues that pediatricians have been thinking about since the very beginning of this pandemic. How likely are children to contract or transmit SARS-CoV-2, the virus that causes COVID-19? What is the range of disease presentations in children, and why does this differ in some children versus others? What does this mean for in-person schooling and families, as I mentioned before? And when will we have a vaccine for children? Next slide. So first, focusing on the first two bullet points. Next. So I thought I would just start by showing you the stats of where we are in the United States. These are the graphs from the COVID tracking project that show the daily tests, daily cases, currently hospitalized individuals, and unfortunately daily deaths. As I think we all are likely aware, there have been multiple waves of hospitalizations and cases in the United States, and those deaths typically follow the hospitalizations by several weeks, and we are unfortunately on an upswing in that period now. Next slide. So what does this mean for cases in children? I pulled this from the Georgia Department of Public Health website today, and this focuses on kindergarten through 12 school-aged children on the left. So similar to what we've seen in adults and the population as a whole, there have been several waves. We experienced an increase in cases over the course of the summer that trended back down, but now is on the way up. And then on the right side, you can see the clusters that have been reported of COVID-19 in either daycares or schools. And one thing that's really emerged over the course of this pandemic is that younger children do seem to be less susceptible and to spread the virus less, which is why you see the pink bars being much smaller than the green. And many of these daycares have been open consistently throughout the pandemic to serve the healthcare workers and others that are essential workers in the population. So on the whole, children have accounted for about 9% of all laboratory confirmed COVID-19 cases, and they represent about 22% of the US population, just to put that in perspective. And thankfully, they're less than 0.1% of the COVID-19 attributable deaths. So this is an important thing in children, and none of us wants children that we know, or our own children, to develop COVID-19, but it is less frequent on the whole than what we're seeing in adults, just to put it in perspective. Next slide. So I asked the question before about how likely are children to catch COVID-19. There have been a number of studies, and I just pulled one out for your reference that was a meta-analysis of previous work that had been published. And the punchline here is that younger children do appear to have a reduced susceptibility to acquiring infection with SARS-CoV-2. But however, children ages 10 and older, and likely even in the sort of older adolescent range, have similar susceptibility to adults. And that's been one issue that has sort of plagued the COVID-19 literature, is that children 0 to 18 have often been binned into one study. And unfortunately, or fortunately, we're learning much more about different categories of children, and that grouping them in much smaller age ranges makes a lot more sense to really understand the pathogenesis of this virus. Next slide. So what about transmission? I think this is still a little bit of a question mark. There were a number of studies early on that suggested that children were a lot less likely to transmit the virus to other people, particularly in the school setting. We've heard from many other countries that had schools open at various times over the course of the pandemic, when schools in the United States were still closed. And in the majority of those cases, there were very few outbreaks. However, there were some very notable exceptions in which the virus did spread throughout schools. So we're still kind of going back and forth on this issue. There was a recent study that came out in the MMWR out of the Centers for Disease Control and Prevention here in Atlanta that looked at transmission within households. And the punchline from that study was that actually there's quite frequent transmission within households, and children could transmit to their household members, particularly siblings, just as easily as adults could. And this is something to keep in mind as we're approaching the Thanksgiving holiday next week. So what happens when children get infected with SARS-CoV-2? As I mentioned, a lot of the cases in children are asymptomatic or mild, quite mild. However, there are some risk factors for more severe disease and hospitalization. And those do seem to be the younger age ranges, so less than a year of age, as well as the older adolescents. Those older adolescents tend to present more like older adults. And risk factors for admission into the intensive care unit include those older adolescents, as well as those with some underlying comorbidities. That is really important to take note of if you are seeing a patient with SARS-CoV-2. Next slide. But one of the features of COVID-19 and SARS-CoV-2 infection that really struck us and struck many pediatricians and pediatric infectious disease providers across the country was the identification of the COVID-19 related multisystem inflammatory syndrome in children, or MISC. This is a recent kind of epidemiologic map from the CDC that shows where these cases have been distributed, and we have sort of the darkest color here in Georgia, so we've seen a large number of them. And this is something that follows SARS-CoV-2 infection in about 2 to 4 weeks later, and is associated with multi-system organ dysfunction, hospitalization, fever, and severe inflammation. And as with other features of SARS-CoV-2 infection, this MISC has disproportionately affected those with Hispanic or Latino ethnicity or Black race. It's about a little bit more predominant in males than females, and the average age has been about 8 years. Next slide. I put this slide here just to reiterate kind of what is this MIS-C for those who haven't heard of it before. The case definition is listed on the right, but also to highlight the fact that this is really one of the areas of ongoing scientific investigation. There are a large number of pediatric infectious disease scientists, as well as scientists in other disciplines, that are investigating the pathogenesis of MIS-C. Why does it develop in certain children and not others? And in order to figure that out, we're studying large cohorts of children, and the Centers for Disease Control has asked us, as well as several other institutions and hospitals, to pool our cases of MIS-C in order to help refine the case definition and really try to hone in on what are the critical features that can define MIS-C and help us to identify what may be the best treatments as well. Next slide. And I won't discuss this in great detail, but this is just a very nice flow chart that discusses what happens after someone is exposed to SARS-CoV-2 and what are all the different possible outcomes that could happen, and how does that relate to the immune system, whether there's protective immune responses or immune dysregulation that can actually lead to worsening of disease. And we think this is not only happening in adults, but also happening in children and may relate to the development of MIS-C. Next. So one of the things that we've done here at Emory and Children's Healthcare of Atlanta is look at the antibody responses to SARS-CoV-2. And this is a study led by Christina Rostad in the Division of Pediatric Infectious Diseases. And she compared a number of different important groups here in this study: children with MIS-C, children with COVID-19, and then several other control cohorts of children. And what she found was that the levels of antibodies specific for the virus, both antibodies that bind to the virus as well as antibodies that can neutralize the virus, were elevated in children with MIS-C compared to those with COVID-19. And she's further investigating whether those antibodies can be pathogenic in nature and whether they may be driving the course of the inflammatory response that characterizes MIS-C. Next slide. Another arm of our immune system is the T-cell responses. And my lab has undertaken a study of the virus-specific T-cell responses in children with both MIS-C as well as COVID-19. And I won't go into this slide in great details, but we're really learning sort of at the very minute detail level, what are the immune responses that are induced in children who get infected with SARS-CoV-2. And we're also trying to distinguish how those immune responses may be protective or may actually contribute to disease. Next slide. So moving on to the later portion of the talk. So what does all this mean? We're learning about the sort of the epidemiology, the numbers in children. We're learning about the disease course in children. But what people really want to know is, what does this mean for my Thanksgiving holiday, my Christmas holiday, my in-person schooling for my children, as well as when will we have a vaccine for our kids? So let's talk about that a little bit. Next slide. So I think one of the things that we've learned about COVID-19 in schools over the course of this pandemic is that it's impossible to prevent 100% of infections if in-person school is to resume. So all of the things that we have heard over and over again still remain important, such as wearing masks, physical distancing, hand hygiene, not going to school if you have any symptoms. All of those things are sort of the baseline. But even doing all of that, it is still possible that a child may present to school who does have infection with SARS-CoV-2, but is not exhibiting symptoms at that moment, but still could be infectious. And so one of the things next slide, or can you go back? Yeah. One of the things that has kind of emerged over the past several months is really trying to emphasize, and I think this is still kind of an emerging area, not quite fully adapted as much as I would like to see, frankly, but trying to incorporate testing in the school setting. And I won't sort of review this model, but there's a lot of information that is coming out about how to best utilize testing for COVID-19 in schools and how frequently to test and which tests that might be the most appropriate. And I think this has really been the missing link to having parents and teachers and children themselves feel like returning to in-person school is a safe and viable option. Next slide. So the last piece, when will we have a vaccine? I think we've all been very encouraged by the news from both Pfizer and Moderna in the past couple of weeks about their vaccine efficacy, and that is really exciting and is something that is sort of at a couple bright stars on the horizon. However, I have to point out that thus far, we don't have any information on these vaccines in children. The Pfizer trial did include children from the age of 16 and up, and they have plans to study children from the age of 12 and up, but we don't have any of those specific data available to us. So there have been a number of commentaries related to the fact that children still seem to be lagging behind or stuck in neutral when it comes to advancing COVID-19 vaccines. And some of this may relate to sort of an old foe of the pediatric infectious disease world, which is vaccine hesitancy. And at the very beginning of the pandemic, we wrote a piece that incorporated some of those features of vaccine hesitancy and how that might relate to the rollout of COVID-19 vaccines. Next slide. So now I just, at the end of this talk, just like to emphasize the vast number of contributions from the Atlanta area to the pandemic response. There's really been, it's just been astounding to see what scientists, public health experts, healthcare providers, graduate students, medical students, and many other people have contributed to responding to the pandemic. And I think it's truly a testament to team science and people working together to address a pressing healthcare need. Emory has been at the forefront of testing a number of the vaccines, particularly the Moderna vaccine. There have been studies that have sort of large studies that have rolled out to investigate the immune responses, to visualize COVID-19 disparities, to bring testing to the places where tests are needed most, such as with poultry workers in rural Georgia. And one of the areas that I've been involved in is this Rapid Acceleration of Diagnostics, or RADx program. And this is led by Wilbur Lamb and Greg Martin, who are in the Department of Pediatrics and the Department of Medicine, respectively, at Emory University, as well as Oliver Brand at Georgia Tech. And this is a program where we are testing the tests, as it were. So we receive tests for COVID-19, mostly rapid antigen tests that are sort of broadly needed. And we put them through the paces where we test what the limit of detection is. We test them in the healthcare setting, we test them in the drive-through setting, and we provide that information back to the NIH, who then sort of chooses which of those tests to provide additional funding to move forward. So that's been a really, I think, fantastic team science effort to try to move the field forward. Next slide. And part of all of these efforts has really been the fruit of many people's labors, has been the publications that have come out. And this is just a selection of those publications. But as you can see, they relate to treatment, vaccines, immune responses, testing, epidemiology, antibody responses, pediatric manifestations, et cetera. So this is just, and all of these have been led by Emory investigators, as well as collaborators at many institutions, kind of all working together. Next slide. And I just wanted to end by highlighting a couple of student contributions that I've seen over the course of the pandemic and really have been amazed by. So one of the things at the very beginning, as the new literature was coming out at such a rapid pace, was sort of how do we digest all of this new information that we never really, and many of us, even if we were in infectious diseases, did not know much about coronaviruses before COVID-19. And the Emory School of Medicine students started a program where they created these visual abstracts. So they would take a paper or maybe one or two papers and turn them into what you're seeing on the left side of the screen. So a summary of the findings of the paper, also listing what the limitations might be or what the next steps would be. And this was really sort of widely utilized, I think, across the country and the world to help us all digest the new information. And in fact, this was turned into a resource on the Cochrane Library. That's what's depicted on the right side of the screen. And I love this quote from one of our Emory MD PhD students here. I love how my interest in art and design can intersect with my passion for medicine and research. And really, that's exactly what these visual abstracts are. Next slide. I also wanted to share two more stories. One on the left are some of our Emory MD PhD students who at the very beginning of the pandemic were working in labs that were, or in research environments that were not operational. And so they had some extra time on their hands and decided to create vats of hand sanitizer to deliver all across the healthcare environment. And so I think it's just a great example of how people sort of look to what they can contribute. And there were many other people that were sewing masks and things at the very beginning. It was really a very inspiring time while we were all facing this this pandemic, and it has continued until this day, as you all know. On the right is another Emory MD PhD student who became sort of famous overnight for participating in one of the COVID-19 vaccine trials. And so I encourage you to sort of check out some of the videos and information that there is on the internet about Sean Doyle. And it's really been inspiring to see how the students have risen to the occasion. Next slide. Next slide. Okay. All right. So just in closing, I'd really like to, again, thank the ARCS Foundation for this opportunity. Hopefully I was able to, in that kind of whirlwind tour, share with you what we've learned about COVID-19 in children and really emphasize how teams of scientists, healthcare providers, public health experts, students have all come together to address this pandemic. I'd like to acknowledge the patients and the families for their participation in all of these research studies. My colleagues listed here at Emory, all in the Division of Infectious Diseases, who have been sort of dedicating their lives for the past several months to this pandemic, as well as the members of my lab who have been deployed from other research projects to now work on COVID-19, the clinical research coordinators and nurses who have been sort of really the folks leading the charge on the ground, as well as funding that we've received from Children's Healthcare of Atlanta, Emory University, the NIH, as well as the FAST Grants program to do this work. And lastly, I'd just like to speak directly to the ARCS scholars. You guys are amazing. I've been reading about you on the website and hearing from you earlier in this program. The future needs you, the present needs you, so please don't give up and make the most of what you receive from the ARCS Foundation, as well as from all of the other resources you have available to you, and pursue your dreams in science. We need you. Thank you very much.
Thank you so much, Dr. Chahroudi, for all the hard work you have done and all the great work that is ahead of you.